each state does have the option, under Obamacare, probably even before that, but certainly now in the letter of that law, to go to a new payment system if the state wants to. And I think what would be the way for the state to go is to develop a system for a uniform single pool of payment. Instead of having many, many different insurers, many sources of payment, very high complexity. If you change your job, you're going to have to sign up again and go through all, figure out what your insurers are. You're different employers, you have different relationships with different companies. Benefit structures vary wildly. Co-pays, deductibles, coding systems, billing systems. It's a mess. And when that's been studied, and I've been one of the people that studied it, but there are many independent studies of waste in healthcare, where there's stuff going on that has nothing to do with helping patients. The biggest single pot of wasted effort that just doesn't help anybody is that complexity of the system. So many different billing procedures, so many different rules, so many different transactions. What we could do, and I think we should do, is take the existing sources of payment from employers, from your contribution to your premium, from GIC, Medicare, Medicaid, all of the different flows, put them into a single pool. That is a pool that's publicly accountable. It would be administered, I think, by a commission structure. We would have the Massachusetts Insurance Commission, which would then be the single payer, no matter whatever hospital we're going to, whatever doctor you're using. It's always the same form, the same payment, the same structure. If you change jobs, you still have the same insurance. All of that complexity has gone away, and all of the paperwork and support and front office support, back office support behind that goes away. What's the benefit? Two benefits. The first is a lot of money gets saved immediately from a decrease in the amount of complexity. The estimates vary, but another state that's looking at it now is Vermont, and the model that was produced in Vermont by two Massachusetts scholars and economists suggests that single payer in that state would reduce costs, just single payer would reduce the costs by about 12% in the first 3 years and 26% in year 6. And that's not hurting anyone at all. All the care is the same. This isn't a government takeover of care. It's the same care system, but there's just less payover. And that's a massive amount of money. It's 42% of our state budget. So if you do the math there, and you could reduce the complexity and get back 5% of that, 8% of that, which is less than the Vermont estimate, we're looking at $1 billion of money freed up in the state budget to use for East-West Rail Link, or for safety net, or for schools, investment in schools. And on the private side, the same complexity is applying. So all the employers, including, I'm sure you're paying for that complexity. And if that goes away in a single pool system, then that money goes back to the employer and the employee. And that's available. You can pay employees more, you can invest in a new plant, you can if you're for-profit, pay stockholders. So I think it's an economic boom to be able to go to a single payer system.